From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I'm your host, Jeff Reed. I am absentee without my co-host, Chris Marr. Chris had some very extreme, well, I'll tell you what he had some very extreme medical business that he had to attend to today. So, Chris, hope you have no bogeys on the fourth hole, and good luck to you. But we will miss him today, but that just frees up more time for our guest today. And this may be as hot a topic in the United States as anything going on. And we've been blessed to have great assets here in town. And today we're going to talk about something that hits all too many people at home. And it's a lingering problem, unfortunately. And can relate. We're going to talk about Alzheimer's dementia. We're going to differentiate. We're going to talk about how do you get this disease, what happens when a loved one or yourself have been encompassed by this. I personally attended a meeting last Thursday with Cheryl Fluharty, who runs a tremendous program out at McElveen Manor. And today we are fortunate to have Mr. Sam Wiley and Miss Elizabeth Brantley, who represents us throughout the state. And guys, thanks for coming in on this Saturday morning.
Well, thank you.
Thank you. Well, what we like to do, just to start things off, Sam, and we'll start with you. If you can give us some of your background and then also inform everyone of your position and talk about the kids and family if you need to. We're all here. This is a family show.
Will do.
Thank you, Sam.
Well, thank you, Jeff, again, and we really appreciate this opportunity to be here with you today. A little bit about me. I've been in the aging disability field for over 14 years now. My background is a case management information referral. I have worked with Adult Protection Services. I have worked with Area Agency on Aging, collaboration with the Lieutenant Governor's Office on Aging, and now I have the pleasure and opportunity to be working with the Alzheimer's Association as the Vice President of Programs for the state. My job actually is involved with delivering programs and services along with Elizabeth and several of our program staff across the state to enhance care and support for families, providing the needs that they may have, looking for the services that they may be able to get, but also as we're trying to make sure that we are identifying other areas of needs in the state. So a little bit about me, I do have a wife, kids, 2 kids, 7-year-old and a 2 back very soon for our 7-year-old, keeping us busy. But all in whole, I'm very fortunate to be involved. I work extensively with people with Alzheimer's and related dementia, mental illness, aging, and disabilities. So I've had a good compass of where we are with things in not only this state, but maybe nationwide as well. Fantastic.
And Dr. Clay Louder, who's a good friend of mine, is a huge Clemson fan. So go ahead, throw the dirt.
We're
right now.
The Tigers are excited. We understand, okay. And we know. So, yeah. But, we won't go on to that.
Okay. This is here, Elizabeth. Talk
Sam
to
and
us.
I are both big Clemson fans.
Okay. Well, now that's more enthusiasm. Okay. All right.
My name is Elizabeth Brantley, and I am a program director out of our Columbia office. I've been with the Alzheimer's Association now for almost a year. I'm still fairly new. My grandmother was diagnosed with Alzheimer's disease, and so I had a personal experience coming into it, which has made me passionate about the families that we're helping and caring for. Kershaw and Sumter counties are 2 of my main counties that and I'm excited to be here with you today.
All right. Well, now, obviously our listening audience is not sitting in here, and this is not a simulcast like Dan Patrick's show. Are we with child? What?
Yes, we are.
Well, talk to us about that real quick.
My husband and I are expecting our first child in October, a little boy, so we're very excited.
Well, for those that are not fortunate to sit here, there is a glow in this room that is fantastic. So congratulations on that.
Thank you.
Sam and I will tell you, it's just starting, kid.
That's what we've heard.
Well, great. Well, this is such, thank you. you both. And I know y'all put on a great show on Tuesday, coming over here and talking at the library to let people know about some of the services and all the things that you have. So for those that couldn't attend, and for all of our listening audience, dementia is probably the most growing. I see it at my medical equipment. I see it at your service home care. I think Dr. Marr would echo. He sees that a lot too. Some of it may be, people are just living a little bit longer, therefore the symptoms are coming. Times Alzheimer hits in the 60s and such. But let's just talk about subjects here. What is, Sam, Alzheimer's disease?
Well, Alzheimer's disease is a type of dementia that causes problems with memory, thinking, and behavior. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. Dementia, is one of those things that it is not a specific disease. It's an overall term that describes a wide range of symptoms associated with the decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Questions we get is, what is the difference between Alzheimer's and dementia?
I get it all the time.
And then we do too.
Educate
still.
me.
And that's where we are too, within the state and nation. And so what we say is that there are a lot of things that can cause dementia. But one of the things that we're looking at is, as we said, dementia is a general term. When someone states that they have dementia, the next question really should be asked is, what type of dementia? When someone says they may have cancer, usually the next question is, what type of cancer? So that's where we're looking at, is what type of dementia that we're dealing with. And there's a reason why we ask those questions, as is what type of dementia. We know Alzheimer's disease is the most common form of dementia. It accounts for 60 to 80% of dementia cases. But there are also other different types of dementias, and there's some reversible versus irreversible dementias that we probably will maybe talk about to differentiate why it's important to determine what type of dementia we're dealing with.
Okay, so Alzheimer and dementia are somewhat synonymous. Would that a fair assessment?
I think the best way to think about it is Alzheimer's disease is not. Let me take that back. Dementia is not Alzheimer's disease.
Okay.
However, Alzheimer's disease is dementia. There's different types of dementias. There's a vascular dementia. There's a Lewy bodies with dementia, Alzheimer's disease. There's a mixed dementia. So there's different types of dementia. And that's why it's important for us to understand that there are many different types of dementia. And then there's other things that can create things as we go forward with our bodies, physical things that can bring on symptoms of dementia. And that's one reason why, there again, it's going to be important.
And this is what's going to. We can talk about all this. We're here with Sam Wiley and Elizabeth Brantley. As we come up on our first break, I want to thank all of our great sponsors at Bynum Insurance. Give old Karen and Sandy a call, 469-3030. I want to thank Reliable Medical Equipment always for being a great sponsor. Go there and see Richard for your prosthetic needs. Go see Aubrey and Jennifer and Thomas for your respiratory needs. And they're right there on 246 Broad Street. Give them a call, 934-9212. Or if you're in Manning, stop by on Kirby Street. And we're going to learn a whole lot about Alzheimer's and dementia as we come back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with Medical Forum on this Saturday. I want to thank Sam Wiley and Elizabeth Brantley for taking their time out to come in and really talk about a touchy subject that hits so much in Alzheimer's. And Sam, when we left the last segment, we were talking about the difference between Alzheimer's and dementia. And I think you sum that up for everyone. But there's a reversible dementia and a non-reversible. And for everyone listening out there, can maybe Elizabeth, can you maybe take the lead here and talk about reversible and irreversible dementia?
Sure, I'd love to. For the sake of the show today, we will use terms reversible dementia versus irreversible dementia.
Sounds good.
We know that there are conditions that can bring on symptoms of dementia, and we know that infections in the body that go untreated, like a urinary tract infection, for example, can bring on symptoms of dementia. We know that individuals that stay in a constant state of depression, particularly for a long period of time, may experience symptoms of dementia as well. We go and get the proper medication or treatment, and we will start to see the dementia will go away. Thyroid problems, medication mismanagement, medication interaction, vitamin deficiency, that we are all different, and our bodies respond to these things very differently than one could be with dementia. And I think Sam had a good example of this.
Well, I did, and it's, we see examples all the time where I was working with a lady one day, and I was in a facility. Actually, it was in Lawrence County, and she came up to me and said, Sam, my mother-in-law has dementia, Lewy bodies with dementia. And I said, well, I'm so sorry. That's, sorry to hear that. And how's things going? And so I asked her, I said, so what did the doctor say? When did she get diagnosed? And she said, well, actually, the doctor hasn't diagnosed her. She said that, I went to the internet and did my research, and I know that's what she has. And I said, well, listen, do me a favor, just rule it out. If anything else, go talk to the doctor, make sure that's what we're dealing with. And so you're sure about that. So I actually was at the same place 2 weeks ago, 2 weeks after that. And so she came running up to me and said, guess what? She said, my mother-in-law does not have Lewy bodies with dementia. She said that the doctor told her that her electrolytes were a little out of whack. He said, give me 2 days and I'll get them regulated and she'll be clear-minded again. And so this is why it's so important for people to understand that if we're dealing with a little bit of memory issues or problems, or we see that, we do need to go see and talk with our physician. These are medical reasons why these memory impairments or concerns are coming up. There's a very good chance that someone may not have Alzheimer's. They could have some other physical ailment that's taking place in their body, and it's causing these memory problems. They can go and get like I said, as Elizabeth said, the proper medication so that they're able to clear that up, hopefully, and not have these irreversible types. So that's where we go with the reversible. There are so many things that can affect the body, and it possibly the dementia can be reversed. Now, once you get to the irreversible side, once you get to a diagnosis of Alzheimer's disease or mixed dementia or vascular dementia, there's many different types. Once we get to that point, that is a type of dementia that is not going to be able to go away. That is a long-term. That's going to be a progressive type dementia, and a person will have that throughout the period of their life.
So I could go into the physician and say, get hit with the bad news. We've got dementia. But it could be reversible, and I think that gives some encouragement out there. So it's very important to see your physician.
I would say, and add to that, what I tell my families is that I work with is either way, it's good to be under a doctor's care if you're in that situation, whether you're going in and they're going to say you have a bad urinary tract infection that's causing the dementia, or yes, we do think that you have early signs of Alzheimer's disease, then you're going to want to be under that doctor's care either way to start having it treated.
That's great. I mean, you think sometimes we get diagnosis and we think, well, this is the end of the world. And, I did a little research, and I'm a novice, and you guys can head injuries. I mean, we're talking about, listen, I watched the Hall of Fame inductee, and sadly, Junior Seau, one of the greatest football players ever, probably had a form of dementia if you really get down to it, because he had so many head injuries, and unfortunately, for those who don't know, he took his own life and shot himself. And so possibly a diagnosis of dementia was given to him, but also possibly don't give up. And don't give up certainly on a loved one or relative, because we have medications out there that could possibly reverse it. So, and then sadly, if I'm kind of drawing a conclusion to everything, we do have irreversible dementia, which is a whole different diagnosis. And then we travel through that adventure for what could be the next few years. And let's just talk about that. How many people are diagnosed or affected? And let's not talk about the caregivers and all the family, because I could go into millions and millions and millions. What right now in 2015, how many people are affected by the Alzheimer's disease?
We know that there are over 5 million Americans affected with Alzheimer's disease. We know right now in South Carolina there's anywhere between 79,000 and 80,000 individuals with Alzheimer's disease. And we're still expecting to see those numbers continue to rise as we go forward, because there's no way to prevent it, there's no way to cure it, and there's no way to treat it at this point in time with Alzheimer's disease. So many, many more people are being affected. There are a lot of reasons, and research is coming out more today, helping us to understand more about it. And so it's very interesting to see where we are and where we can be with the proper continued amount of research put in place, with a better level of understanding of what we're dealing with.
We're here with Sam Wiley and Elizabeth Brantley from the Alzheimer Association here on Medical Forum. Just a wealth of knowledge out there for us to learn. And, as we come up, we probably have a minute here, and we may have to enter our third. Tell me about the effect of women in the proportional with them. Elizabeth, maybe you just about that being a female.
Women are getting hit on all sides with this disease, because they are being diagnosed more, typically because women live longer than men, and we know that age is a risk factor for Alzheimer's disease. And also women tend to be the caregivers that are the ones working in the home and taking care of their spouses. Almost 2/3 of Americans with Alzheimer's disease are women. So that's a staggering statistic.
Really? Is it because the men have all died off? Is this what's...
Believe it or not, actually is one of the women do live longer. And so one of the risk factors of Alzheimer's disease is age, and the longer you live, the higher probability you have to develop disease.
We're coming up on a break. Again, want to thank our present sponsor, At Your Service Home Care. Go see them at 607-9677 on 1250 Wilson Hall Road. And we're learning so much, and we'll come back. We'll touch a little bit more on the difference between the women and the trend that we're seeing with women in dementia. And we'll talk about some of the risk factors and some of the look out for, and we'll be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we are back on this Saturday morning, learning a lot, if you're just tuning in, about something that probably hits just about every household, certainly every family. We're talking about dementia. We're talking about Alzheimer's. We've got Elizabeth Brantley here and Sam Wiley. And when we left the last segment, we were discussing women with dementia and Alzheimer's. And Elizabeth, you were talking about some of the factors. And then, Sam, I'd love for you to talk to all of us about all the risk factors that are associated with Alzheimer's. Elizabeth?
Yeah, one big thing for women is stress. I think with more women in the workplace, added stress of managing a household and working, and then a lack of sleep is not good for our body. It's not good for our brain. And so those are two big risk factors.
And living longer, right?
And living longer.
Y'all are kicking our butts.
Women are living
there.
longer.
Sam, let's talk about that, because I know that we've had about 25 shows now. Actually 21, but I exaggerated. You're our 21st show. Congratulations. That's Deion Sanders.
Prime time.
Yeah, even though he's a Florida State, not a Clemson guy. But back, I don't mean to be lied about, but we need to. We have a very serious topic here that we need to tackle head on. And risk factors. I think all the listening audience out there would say, because we see so many things that are unfair. We see people that do the right things, eat the right things. I think our third show we were talking about the guy that, and his name I think of right now, but he started jogging back in the 70s because he had a heart problem, and he died of a heart attack. So there's so many things that we do to prevent ourselves, and genes seem to be something that dominates the equation, no matter how resonant we are to our workout patterns, to our eating patterns. So people listening in, are there some risk factors that increase our ability? Elizabeth, you pointed to stress. You pointed to sleeping. What else do we have, Sam?
Well, there's several that we know researchers have found that have identified specific risk factors, and one of those is age. The older we get, the higher probability we have to develop Alzheimer's disease or some form of dementia. It likely to develop an Alzheimer's doubles after about every 5 years after the age 65, and after the age 85, the risk reaches nearly 50%. age is a primary risk factor, but one thing I think it's important for people to keep in mind is that we do see younger and younger individuals that are being diagnosed and being affected. I think part of that is because of the fact that we know more and we have more technology and tools to be able to do proper diagnosis, and we understand more. But age is a risk factor. Family history is another risk factor. We have the genetic links that's involved. Genes that we've identified and we call them risk genes, and then we have another set of genes that we call deterministic genes. And so a lot of times people will say, should we look into getting genetic testing? And that's something that everyone can keep in mind and think about. Something else that they can also do is if you're able to look into your own family, if you have a parent or brother or sister with Alzheimer's disease, then the likelihood of developing a disease increases a little bit. It doesn't mean that if you have Alzheimer's disease in your family that you will develop Alzheimer's disease. It does not mean that. It's that it may raise the probability for you having the disease versus someone who doesn't have it in their family. So we have that in place when the diseases tend to run in families, either genetics or environmental factors or both may play a role. So those we do see that age and genes play a specific factor in our risk with Alzheimer's disease.
Well, anytime that we talk about the warning signs, then maybe what we need to talk about is how we could possibly prevent it. And in my nominal research that I did to prepare for this show, a lot of people that have prepared to prevent dementia, they always talk about crossword puzzles, working their mind, constantly doing things where they're mathematical. But what I found very interesting was that vascular problems, and when we talk about that, we're talking about COPD, CHFS, and such like that. Do you exercise?
Exercise is extremely important.
Yeah, and people I don't think understand it because they see that, we get obesity, we get cholesterol, we get our heart. This is our mind that getting out and working out, walking around the block, staying active feeds this.
Living longer.
Yeah.
We're living longer with more chronic health problems. What we know is what's good for the heart is good for the brain. So it's all connected. So if there's something that's taking place possibly within the body, there's a health problem within the body, then that somehow got to be impacting the brain, and that's what research is showing us. We know that exercise is one of the best things that we can do, and that's one of those things we've heard. You hear about proper exercise, but then other health factors. What's the same thing? You get the blood flowing throughout the brain and through the body. So exercise is just starting to show. Exercise, proper diet. For me, I'm guilty not having that biscuit in the morning. I'm as guilty as anyone else. But the proper diet, more leafy, green vegetables versus are these fatty, high cholesterol, fatty diets. Social engagement is something that's been talked about. A lot of people with social engagement and being more engaged. But also when you talk about the puzzles and crossword puzzles, something to keep in mind is those are good things to do.
Right.
But what we also are seeing is that learning new things. Not so much doing their daily crossword, because I'm not good at crossword puzzles, but I know some people that can do them just in their sleep. But when we learning new things and taking up learning new things, those are the things that we're starting to see that can help really, quote unquote, train the brain, so to speak.
Well, and you know what? Sumter, South Carolina, is the number one city in the United States per capita for stroke.
Wow.
Yeah. I mean, we've learned that on our show here. Number one. Not Little Rock, not Boulder, Colorado, here. So when we start talking about all things that we can do, and we think chicken and that lack of exercise and such, this is also, if we can get over the and things like that, dementia might be just knocking on the door right around the corner. Is right?
We can't say that we can prevent Alzheimer's disease at this point in time, but what we can say is that if by proper diet, exercise, learning new things, and maybe even being socially engaged, that we can possibly delay an onset, even prevent it, maybe even from happening at certain times. So that is so important that is one thing that we can control. It's very hard to change that lifestyle. Those lifestyle changes, that as much as it happens, it's been documented. So if we can change the lifestyle and do that proper exercise, we can make a change.
Awesome. And speaking of changes, a little segue there. There's no better place that can take care and as takes care of patients than our hospital here at Toomey Hospital. And we always tell all of our listening audience out there, let's stay at home. Let's use our hospital. Let's use our medical physicians and stuff. And what's great about Elizabeth and Sam being here is we can stay here and work on our with our family with great support groups. And we'll be back right after this.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admissions Director with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back on this Saturday morning. Elizabeth Brantley and Sam Wiley in the house talking about Alzheimer's and Alzheimer's Association. I want to let everyone know that this show also, if you're catching a part of it or missed it entirely, except for this part, Sunday from 2 to 3. Dr. Marr is not in the house today, taking care of his patients, he says. No, I'm kidding. He's working very diligently. So we miss him today, but that just gives us more time to really learn about what we think is a growing epidemic, and we're going to see nothing but continued numbers of people due to medications, due to length of people living longer. Elizabeth has pointed out women now have become more inflicted with this terrible disease of Alzheimer's disease. Predominantly, they've either entered the workforce. They also have stress a little more maybe than in the 50s. Not that raising children's not enough, as you'll find out, Miss Brantley. But also the fact that they just live longer. And we have found that there's a trend between age of a person and the capabilities. Sam's pointed out that when you're 85 or older, you got about a 50-50 chance of at least getting inflicted with some part of this. But Alzheimer's Association, which you two for, let's talk about it from a national level, Sam.
All right. Just on the whole, just to let everyone know, we are the world's leading voluntary health organization in Alzheimer's care support and research. Our mission is to eliminate Alzheimer's disease through the advancement of research, to enhance care and support for all that are affected, and to reduce the risk of dementia through the promotion of brain health. We really try to encompass the whole piece here. We were founded in 1980, and since then we've reached millions of people affected by Alzheimer's across the globe through our national office and our chapters nationwide, including South. So from the national standpoint, we're working on many different efforts. One of the things we work on is research, and we're the largest nonprofit funder of Alzheimer's research. The association is committed to accelerating progress of new treatments, prevention, and ultimately we're looking for that cure. Through our partnership and funded projects, we have been a part of every major research advancement over the past 30 years. The last I had heard that we were the third largest funder for Alzheimer's research. The NIH, National Institute of Health, is number one. The Chinese government is number two, and then the Alzheimer's Association nonprofit. So that's something that we really hang our hat on. But we're involved with research grants programs. We do the Alzheimer's International Research Conference every year, bringing all the new scientists together, working on research. They talk about their findings. We have an Alzheimer's and Dementia journal, and we also are involved with Alzheimer's Association International Society to advance Alzheimer's research and treatment. We're bringing researchers from the world together so they can start talking for the first time about what's working, what's not working, to try to move that forward. And from an advocacy standpoint, we're also advocating to the point where we find critical Alzheimer's research, as I said, but we're also looking to develop policy resources and changing the trajectory of Alzheimer's disease to educate decision makers on the economic and emotional toll that Alzheimer's disease takes on our family. We're engaged in elected officials on all levels of government, and statewide and national, and we also are involved in working to literally pass legislation at the federal, state, and local levels to benefit all that's affected. So we're tremendously involved from an advocacy effort. We have our hands in Washington, working with them closely. We're involved with the research team we really are trying to eliminate Alzheimer's disease.
Awesome. Elizabeth, he eloquently spoke about from a national level. We see it here in the state of South Carolina. When we start talking about specifically Sumter, in this area that we're speaking of, Clarendon, Kershaw, we are the hotbed for vascular problems. Therefore, we have to be a hotbed for the dementia, Alzheimer's, and I have seen the work that Santee Watery brings in the work that you've done here, albeit 1 year in, but you're very active in here. Tell us about.
Sure. Here at the South Carolina chapter, as well as other chapters across the nation, we're working to enhance care and support for the citizens of our state. And we do this through a big way that we do this is through our 24/7 helpline. That number is 1-800-272-3900. And this offers information and advice in the form of information and referral, as well as care consultations. It's staffed by master's level trained counselors, and what I really advocate for and like about it is that it's 24/7. It's there when you need it at 2 in the morning and you don't know what to do, and you need to bounce ideas off of someone who knows what they're talking about. This is the place to go. And then they will actually pass along that information to us locally for a follow-up from right here in South Carolina. So you're not talking to someone who's just at a national level. Another thing that you've mentioned already in this program is our support groups that we provide. And the one here in Sumter is the first Thursday of the month.
That's right. I attended the last one.
Yep.
Just last Thursday at McElveen, right?
It's at 6:30, I think.
6 o'clock, 6:30, and they were there till 9:30.
So that's a
just
great
so you know,
group.
and you know what? They had probably over 25 people, and the weather was atrocious.
No.
And what was wonderful about it, the people were so warm. And I'll tell you, Elizabeth, you had people that were dealing with someone who'd been afflicted, but you had so many people that have gone through the first stage, the second stage, and unfortunately the last stage, where they've had a relative pass away, but they're so engrossed in what you bring with your association. And it was wonderful. It's heart-wrenching, but man, the support there. Encourage everyone to go. McElveen Manor. Cheryl flew hardy. In fact, we'll just throw a little plug out there. Cheryl works for Tri-County, and she is a community resource. And I think her passion very much is for your cause, which is the Alzheimer's Association. I think her mother, from a personal note, was afflicted by, and I don't think that she would be at all upset that I said that. I think that she wears that as a badge of honor. And her number's 803-983-1356. And again, Cheryl Fluharty, who represents Medi Home, you may know them as Tri-County Home Health and Hospice, and they put that Alzheimer's group on that Elizabeth spoke of over at McElveen Manor. And I'll tell you, we're coming up on a short break here, and as we come back for our last segment, we're going to let Elizabeth continue to talk about all the great things that her organization and Sam do from a state. Very, very, very important, and do a great support for individuals. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back, Medical Forum, every Saturday, 10 to 11 here on one of our stations. If you missed any of it or want to catch it again, we re-air on Sunday from 2 to 3. And been fortunate to have Elizabeth Brantley, Sam Wiley, Elizabeth representing our little neck of the woods here in Florence, Sumter, Camden, Clarendon, never forget our friends in Manning, and of course Sam nationwide, helping everyone understand Alzheimer's and just how tremendous their association is. I believe for almost 35 years going nationally, right? And when we broke away, Elizabeth, we were talking about from a state level. I think Sam gave us some great information from a national level, state level. Let's talk about local.
Sure.
What are some of the programs that are out there to help people here?
I just wanted to follow up on our support groups. Like you were saying earlier, there is a great one here in Sumter, but if you're not here in Sumter and you'd like to find one of our Alzheimer's Association support groups, you can call our 1-800 number. It's 24/7. It's 1-800-272-3900. Or you can go to our website, and that's www.alz.org/SC.
Oh, you got to say that again. Say it. And I mean that sincerely. Someone's grabbing a pen right now going,
alz.org/South Carolina, SC.
Okay.
Did I make that confusing?
No, you did it great. It's just we want to definitely give everyone an opportunity to get that.
There are great resources there on our website that we provide for caregivers and families. We have the Alzheimer's and Dementia Caregiver Center, and that features sections on early stage, middle stage, and late stage caregiving. So no matter where you are in this journey, there's something there for you. We also are able to offer our free online tool called the Alzheimer's Navigator, and that provides individuals with Alzheimer's and their caregivers with step-by-step guidance and customized action plans. And then one more thing that I find very helpful is the Community Resource Finder, and that provides instant access to community resources and services. So you can just go on there. It's communityresourcefinder.org, I believe.
Resourcefinder.org.
And just put Sumter SC, and you can choose what you're looking for, and everything will pop up.
Support, where my support groups.
You needed an elder care law attorney, that's on there, and you just click that, put in where you are, and the contact information for those people will come right up.
That's fantastic.
We've also provided a lot of community education programs for professionals and families, in that, like we did with the basics of Alzheimer's this past Tuesday. We also have clinical trials, active clinical trials going in the state of South Carolina for those that are looking to possibly find and looking for possibly enrolling in some type of trial. We have safety services. We have a Greenfield library online. We have many, many services that we are offering to families. So if you please don't go through without contacting us or finding out what services are available. 1-800-272-3900 or www.alz.org/SC.
Old backslash. You know, you work here in the community, and we've seen at your the great vouchers and grants that are out there, and I don't think people realize that. And we talk about trying to educate people, and I love what you guys are talking about, because one of the things that we try to emphasize at your service is your need may not be what we do. What we do is we sit with the elder. We take them to the doctor appointment. We take care of them. They may need help bathing, dressing, eating, and such. But we also try to elderly law, if that's a problem, medical equipment if they need to see a doctor today, we can do that. Help them with pharmaceuticals. That's what's beautiful about your website. You know, you're not just there to talk about dementia. Maybe we need to make some legal, decisions. We talked about directives. How if we get to a certain point, how are we going to continue to live and such? And I think that's a tremendous just a service that you get, and people don't know about this. And we see people that get this terrible diagnosis with a loved one, and that's the start of this snowball effect, because now it's like, okay, where does Medicare start and where do they stop? And unfortunately, when we're talking about needing help in a home, or we're talking about a nursing facility, we're talking about cost. And you guys have a tremendous program. I know that you work with Santee Watery on vouchers and filling out paperwork and just allowing them to know that, hey, the Lieutenant Governor, give some kudos to them for recognizing this problem. And as we go through all the budgetary constraints out there with our state, not forgetting your association, Sam.
Well, let me just say that, well, first of all, we are tremendous to have the opportunity to work with the Department of Mental Health, where we get our respite funds, our Alzheimer's Association respite funds. So we are receiving respite vouchers that we're able to issue to families to give that respite care to those family caregivers, providing that daily care, because we all need a break. This comes into play. So we are able to offer, we are partnering with the Lieutenant Governor's Office on the Aging and the area agencies on aging, so that we have been able to work very closely with them to offer our Alzheimer's Association vouchers and be able to help families receive possibly some other respite program vouchers through the Lieutenant Governor's Office on Aging, Area Agency on Aging. And these vouchers can be used in the home. They can be used in a facility. They can be used in adult day service. It can be used with a private individual. It can be used with a provider. It is about choices, and it's about helping in need. So that's something for everyone to please be aware of, that we are able to provide those respite vouchers. And the best way you can reach us to learn more about that is 1-800-272-3900.
Yeah, I think the person that gets lost in this, and not to at all diminish the patient who's been diagnosed, there's a caregiver, there's a wife, there's children, it's a neighbor or brother, and here are people that they also live with this every day. And it's just a very sad diagnosis. You guys do such a tremendous job. And we're coming up, we got about a minute left in the show. We got Sam Wiley in here representing Alzheimer's Association. Got, can we call her a running buddy?
Yeah, absolutely.
Running buddy and partner Elizabeth Brantley, about a year on the job here that we'll see a lot of.
That's right.
In the next year. You guys, I can't thank you enough for coming. I'm honored that you could take time to come in here and discuss a very touchy subject, but something I know that is very dear to y'all. And again, Elizabeth, contact one more time, and then we'll send everyone home.
You can actually contact me through our 1-800 number. It's 1-800-272-3900, and I'd be glad to talk to you.
There, or ebrantley at alz.org. Y'all, thank you so much. I've enjoyed it, and I'm sure the audience has as well. And we'll see everyone next week on Medical Forum.
Thanks.